Have you decided who your advocate would be if you were going to go to the hospital either for a day surgery or procedure or even a few days? They should be more than a ride for you. There's so many things an advocate could do. For one, we want to make sure that they'll take notes when the healthcare team is talking to you and make sure you understand what they're saying. They could write down your questions ahead of time. When you start talking, they should start writing. Because when the medical providers come in, it's so easy to forget what you wanted to say. They can carry your list of medications, past procedures, doctor's numbers. They could also have the list of for your health insurance, even your clergy, friends, and family members that they can have on hand to call when you're finished. An advocate could bring things with them like the pen and paper, a book to read while you're resting. They should also bring change for vending machines and possible parking. They could bring hand sanitizer and things to wash down the furniture, the bed rails. We always encourage that they might bring lollipops or Twizzlers to hand out if they want to ask somebody to wash their hands. Are they willing to ask someone to wash their hands before they touch you? Asking someone to wash their hands is not easy to do, but it is a sign of respect for the patient, and the patient can trust their healthcare team to wash their hands, besides the fact that it can help avoid infection. Will your advocate be willing to escalate a concern, talk to the nurse, and then if possible, they may have to move to somebody else? Will the advocate ask questions and wait their turn to speak? At Pulse, we don't ask you to sign a HIPAA form. We don't need to know your information. We need to make sure you know your information. And if you don't understand what's being said, we can help make sure that you don't leave until you do. An advocate can help pull a team around you, family or friends, people from your religious home, your apartment complex, some organizations that you belong to. People generally want to help, but they don't know what to do. And if you're not comfortable asking, make sure your advocate is willing to. There probably is a support system out there for you. You just may need to find it. Be sure your advocate is not too emotionally invested in loving you that they can't be objective and help you choose what's important to you. If they are too close to you, then you might want to find somebody else. But talking it out now, who will be your advocate, maybe you'll be the advocate for someone else when they need you. A patient advocate is more than a ride to the hospital or the doctor's office. They need to be ready to be assertive but respectful and have the patient's best interest at heart. This is Eileen Carina with Pulse Center for Patient Safety Education and Advocacy. This is another Patient Safety Minute.